Good evening, sir. So, shall we start? So, you can start sharing your PPT. We'll be starting.
Yeah, sure. So we have got two active candidates today, right? So I am sharing the screen. Whoever is the active candidate, just unmute yourself and start. Yeah. Hi, doctor.
This is going to be a very interactive session. It's a request to all to kindly unmute your mics.
Yeah. So like our usual, I am like I'm visible on the screen, right? Yeah. So like our usual sessions, we shall be doing two cases today. The first case, each case will be around 20 minutes, and then we shall have a, like 15-20 minutes discussion. So the first session I think will be done by Dr. Amla. Okay. Dr. Amla, you are ready, right?
Uh, Sir, I'm ready, but I actually, I mean, I haven't yet even started any PACES preparation. Like long back, I had done almost 7 years back, and now, like I was doing anesthesia, and now I'm again restarting PACES preparation. So I mean, I don't know if I'll be able to continue for 20 minutes talk. Like, I have almost forgotten everything.
That's okay. Just give it a try, right?
Okay, sir. Yeah.
Mm. So yeah, like take around 5-6 minutes to go through it and just prepare yourself, and then we shall start.
Okay.
And there are two slides. Once we're done with this session, move to the next slide.
Hello, Miss Sochi. I am Dr. Amla, and I'm going to discuss about your latest investigation reports regarding your uh, ongoing treatment. So, how are you feeling today?
Yeah. Good morning, doctor. I'm feeling a bit better. Thank you.
Okay. So, how are things going since last few months for you?
Yeah, doctor. So since the last few months, I'm a bit down on the sun. I'm feeling a bit tired and lethargic. I'm not feeling very active. So what I did was I went to my GP, and he prescribed me some tests, blood tests and scans. And then I went back to him with the reports. He told me that he had some bad news for me, and that my function of my organs, like of the kidneys, those have gone bad because of the disease that I'm having. And so he has referred me to this clinic today.
Okay. Like, have you been taking your medications regularly till date?
Yes, every day as per the prescription, I am taking it without any miss.
Okay. As your GP has already given you some idea about the test results,
Mm-hmm.
so I'd like to elaborate on the same. So, basically, as you are already aware that you have this lupus SLE
Mm-hmm.
since about 8 years,
Yes.
so so are you aware of the have you read about the complications or the organs that can get affected by SLE?
Yeah, like I am suffering from this disease for the last 8 years, right? So my doctor, the rheumatologist who has been seeing me,
Hmm.
so she has already told that I may have got certain complications in some other organs. So yeah, I know a bit of it.
Okay. So, because of the because of the challenging you know uh, management for this type of condition, as you must be already aware, so as your report shows that your kidneys have actually reduced in size. That
Mm-hmm.
means your the normal functioning of your kidney has reduced. Now, all of us, how kidney function is that whatever we intake we are taking in our body, so kidney will remove the toxins and the other harmful products from the body via our urine, and that's how the balance is maintained in our body, so we don't fall sick,
Fine.
especially the electrolytes level, sodium potassium level.
Okay.
So what happens is that in your case, because of the disease per se, your kidneys are not functioning well. In fact, the report shows that the the filtration or the amount of urine that should be produced normally, and the function of excretion, that is removal of toxin, is greatly reduced in your case. And
Yeah, doctor,
to
I'm aware of that. My GP has already told me this.
okay, so the thing is that because of that you are feeling lethargy and all. So
I
in this situation, uh, only treatment available is something called uh, dialysis or transplant. Are you aware of them?
My GP has actually told that I may require dialysis. After that, I went and read it up, and I found that the disease I'm suffering from, this SLE.
Hmm.
So these patients often go become dialysis dependent. Ultimately, there was some mention about this transplant. So I shall like to know more about these options today.
Okay. So the thing is that in your case, because the kidneys have deteriorated far more than expected, so in dialysis, what we'll do, there will be a separate machine, and mostly you will require thrice weekly dialysis, where we'll create one channel in your hand, in your arms, so the through which we will circulate blood and a filtrate via that machine, so that the toxins that are supposed to be removed via your kidney, that function will be taken up by the dialysis machine. However,
Okay.
so that over your you don't develop the symptoms that or the problems that you are facing currently. So the issues of developing side effects for not for having damaged kidney will be reduced. But
Okay, doctor. So you told about something like there'll be a channel in my hands. So what's that about?
okay, so it's basically they'll create a fistula. Okay, it's a medical term. So
Okay.
basically you must be knowing that we put cannula to give saline and
Yeah,
all
yeah,
that.
that's what I'm asking about. I'm not asking how is it made. I'm asking that I know about these cannulas. These I have been admitted before because of the disease, and they are
Yes,
really painful. So this channel that we're talking about, through which the dialysis will be done, and you have already told the frequency of that, which is like alternate day, like right, 3 times a week.
right,
You already
right.
told. I was not aware of that. It will be that frequent. So, like, it will be very painful, right? The for getting that permanent thing in my hand.
Initially we have to create that channel. So initially it will be little painful when we are creating the channel, but we'll give anesthesia so that you don't get that much of pain when we are creating that channel. But on a alternate basis, when you will be coming and will be using that channel, so we can use some anesthetic agents, like some numbing agents on your channel, so that when we are putting a cannula, you don't feel that much of pain. Because as you are saying that you are hypersensitive to this cannula insertion, so we can use some numbing gel which will reduce the intensity of pain when we are putting the cannula through those channels. That is one way of doing it. But obviously the benefit that you will be getting via this dialysis will be far more than, the minor pain or the little prickly sensation that we'll have when we are putting the cannula.
Okay.
That is
Okay,
one thing.
I'm okay
Yeah.
with that.
Hmm.
So apart from that, like during this, as you told that the blood will be taken out and it will come back in my body again, right?
Right.
So yeah, so like, will not there be other problems associated with this?
Yes, for any intervention that we do on a human body, there will always be some complication. So in your case, when we are actually, taking out your body blood and we are passing through that machine, there will always be some chances, like, your BP dropping very low, or you are developing some rash, or some other
Mm.
side effects of this procedure.
So what are
So
those side effects? I want to know about that, because I already know the advantages that my kidneys are not working. So I shall require the dialysis. Otherwise, the kidneys will not work and the toxins will not go out. So what are
yes,
the side effects apart from
so
the what I have told?
yeah, so one of the side effects is your BP falling very low. So that's why you will be, these procedures are done in hospital setting, where you'll be constantly monitored when the dialysis is happening. And then some other side effects depend on the type of dialysis, which we can explain you later. The concerned doctor will explain. And also sometimes you can develop uh, the side effect of the medicines that are used in dialysis. For example, we use something called heparin. It is a type of blood thinner to prevent blood getting clotted when it is being circulated. So that also can, cause a a problem in your body. But we
Mm.
always make sure that we are alert, and, we at any given sign, we will stop the procedure and we'll first treat you, and then continue the procedure. So there is always backups available to deal with the situations that commonly arise via this uh, dialysis. But yeah, definitely there are few common things that we will be managing. Like if you develop hypertension, we may, give you some medicines to maintain your BP. If you develop heparin induced some low plated or something, then we can deal with that. So we will be managing the
Okay,
situations that
understood
arise
this.
during dialysis. Yeah.
So yeah, so understood it. So doctor, tell me something about this transplant option, because it seems that there are some side effects of this dialysis, right? So
Yes.
what if I opt for transplant? Can I directly opt for it, or is there anything else that needs to be done?
Okay. So the thing is that in your case, transplant is also a good option, because the daily dialysis, and given your your age, so rather than getting into lifelong dialysis, transplant is definitely a preferable option. But in your case, there is some additional problem compared to a normal patient, is that your problem, that is your SLE, this is a type of autoimmune condition. That means your body is producing antibodies, uh, or the products which are acting against your own body, that can also, cause harm when we are taking a kidney from someone else and putting on your body. Now you are already on drugs like hydrochlorochlorianol and mycophenolate mofetil, which
Mhm.
will anyways cause some some low immunity. It will reduce your immunity. So when we are transplanting, again we'll be anyways keeping your immunity low, on a lower side, so that your body doesn't react to the transplanted kidney. The antibodies of your body shouldn't react against the kidney, and it can thrive on your body, and it can take over the function of your damaged kidney. But in your case, this problem may be little more aggravated, given your body having the auto antibodies. Another thing is that after transplantation, after the kidney transplantation, you will be put on a immunosuppression, as I'm telling you. And also, to get a kidney, so you'll be put on a waiting list, or there needs to be matching. There is something called HLA matching, so that a lot of procedures are there, after which only the HLA matched kidney can be accepted for any given individual. And it is time consuming procedure as well, because the getting a organ for transplant is not that easy given low awareness. So till you get a transplant, we can put you on the transplant list. We can continue our dialysis, as as I mentioned. And then by the time you are selected, or you get a matched kidney, then we can think about the transplant.
Okay. So, like, next, what should I do? What is your
Okay, so given the severity of the situation, that your kidneys are hardly producing any urine and it's almost failing, so we will get you admitted immediately. And then as I told you, we'll create a channel in your hand. Uh, but that channel takes some time to develop, because your dialysis will be a long term thing. It's not just one day procedure. So till the channel matures, we will be using another access through your neck, where for the first few episode I mean for the first few dialysis procedure, we'll be using that access till your actual long term channel develops. I hope you understood till now.
yeah?
Okay, and then immediately we'll do one session of dialysis uh, for to deal with your current uh, problems, and we'll get all basic investigations done to see what is the condition of the parameters in your body given your failing kidney, and accordingly we'll manage via dialysis. And then we will more we'll get our transplant coordinator team of the hospital, and we'll ask them to have a word with you regarding that option. But
Okay.
immediately you need to get admitted. We'll do the investigations immediately and do dialysis.
Okay. Fine.
Okay.
So, like, we shall end the session here.
Okay, sir.
Okay.
Yeah.
Yeah. We shall end the session. We shall end the case here, and we shall be discussing that how it should have been done, and like you did not do too bad, but of course there can be further improvement. So we shall just a minute. So I am restarting the screen sharing. Yeah. So we shall start from the first. Yeah. So this, you are a specialty register ST2 in the renal clinic, right? This is very important.
Hmm.
I shall tell you why is it important. This is one thing. So you are a very junior person, like ST2, very junior person. Now you are dealing with a end-stage renal failure patient, in a patient who is SLE in a 43 years old lady. So these are the only options that you are having here. As soon as you see this patient and as you go on practicing more and more cases, you shall realize that this is a difficult scenario. This is one of the more difficult cases in a communication scenario. Why is it difficult? Because you have a lot to discuss in a 20 minutes time, right? So what is the information we given? SLE was diagnosed 8 years back. She is currently on these two medicines and is under the care of a rheumatologist. So from here, what are the informations you are getting? Here a case of old SLE on two drugs, both of which are immunosuppressants, right? And she is under the care of a consultant.
Right.
And how we can use this information, or like how can this information be relevant in the while you are discussing the scenario? It is that when you are first starting the conversation after the initial phase, immediately we shall discuss how we shall approach that, but immediately we should be asking this patient that how much he knows about the disease. And the person will definitely tell you that I am suffering from a disease called SLE and I am on these medicines. Or you shall be asking, are you on some medicine? He'll tell this medicine, rheumatologist. So then here needs to ask is that are you on regularly taking these medicines or not? Regular taking medicines or not, which you did. Are you on regular follow-ups with the rheumatologist or not, which you did not? Okay, so these are the two things. And third thing is that is there any side effects of the medicines that we have been taking,
Yes.
right? Whenever there is some medicines mentioned, always ask these things. From when you are taking it, have you stopped taking it recently? If yes, of course you will tell that why did you stop? And even if they are continuing, ask them that have you facing side effects of these medicines? And when was the last time that you followed up with your prescribing doctor, whether it is a GP or a specialist, anything? So these 3-4 questions should be standard protocol whenever you see a medicine is being mentioned in the communication paper, or even in any other stations, also clinical consultation station also. So that is one thing. And this you need to find out when you are these 5 minutes outside the room when you are taking. So now next paragraph. So last few months, which is again not a chronic issue, not a very active, not a very acute issue, right? She's complaining of these features, lethargy and these things, and there is a EGFR of 13. We know now that the patient will require dialysis, and there is also a recent USG done which revealed two small kidneys. Consequently, so what does this word mean? This means that both of these reports have already been given to the patient, right? So the consequently she has been referred to the renal clinic for consideration of RRT and specifically the option of renal transplant. So although not sure, but from reading this you can have an idea that probably she knows why she has been referred, because in UK or in like any place actually it should be, but at least in the NHS when you are being referred to another center, you are as a patient you always are told the why you are being referred, and so it's likely that the patient already knows that she will require an RRT and there is an option of renal transplant. So this information you can pick up while reading the scenario, which will give you an idea of how to start. Because if the patient does not know anything, then it will be more about explaining why the kidneys have failed, why the drugs did not work, or even if the drugs worked, maybe her rest of her SLE features are not okay, but still the SLE has affected the kidney and now the kidneys are not working, right? So that can also be there. So it can also be a case of an angry patient, where the patient may be angry on the rheumatologist or on the GP that I could have been sent to a nephrologist previously. Why was I not counseled regarding this? That can be one scenario. But from reading this, we can be pretty sure that that is not the scenario here. Rather, it is a scenario where you have to explain both the renal replacement therapy as well as the renal transplant and the transplant surgery and the procedure in a single setting. That is why it will be a very lengthy scenario where you are expected to, as a doctor, he is expected to speak more rather than the patient. Whereas in angry scenario, the patient is expected to speak more rather than the doctor. So this you need to find out before you are entering the session. Once, so these are, you wanted to tell something? No, right? Yeah. You can just interrupt me and ask me if you want to tell something else. We shall take the questions at the end of the scenario. So these notes I have made while we were like making the like doing the case. So first is beginning. So how will you start the scenario? The standard protocol. You will be entering the room. You will be greeting the person inside. Hello, good morning or good afternoon. May I know your name, please? Or the name is given here, so you can just ask that. Are you Mrs. Anita Sochi? And are you 43 years old? And once that's done, you will introduce yourself. I am the doctor. I am the ST2 in the whatever is mentioned there. You can tell I am the ST2 in the renal clinic, and you shall start the session. So the first question that you need to ask here is how much the patient knows. So you should be asking, ma'am, may I know what has brought you to the clinic today? And she will tell what I did. That, yeah, doctor, I am feeling this very lethargy and weakness, and I went to my GP. So I was given their test and then scan, and I got the reports. And then the GP asked me to come here, and so I have come. And then you will be asking, ma'am, do you know what the reports told? And then maybe she will tell them that the GP told me that my kidneys are not working that well and the test reports came out bad. Or she can tell that no idea, I do not have any idea. If the patient tells that I do not have any, I mean that patient tells that I do not have an idea, immediately you have to realize that the scenario is demanding you to explain the test results in some details. So then you should be telling that the blood test that has been done, that is something called an EGFR, which is a medical term, but it basically tells you the functioning of the kidneys. Ma'am, do you know, ma'am, you must be aware of what the kidneys are. They are responsible for the water works of the body. So along with the water, it also takes out many toxic products, and that is not working that well. And so you have been feeling this lethargic and the other problems. Besides, the GP has also done a scan, which is also showing very small kidneys. Those are called shrunken kidneys, again signifying that the kidneys are not working very well. And that is why you have been referred here, and that's why we are having this discussion today. Keep it short and simple. Do not think that you have to explain the full EGFR and the full renal scan, etc. here. You you are basically in a drama, and you have to play your role here. So do not use jargons. Tell whatever is mentioned. Do not add any extra information. Dr. Amla, I think the candidate here have added extra information later on, which you shall get back. So this part is done. And if it is the case, it is also a case of breaking bad news. And then you will be telling that I'm so sorry to tell you this. Are you okay? Do you need a time? And of course, the patient will tell that no, I am okay. Can we just please proceed with the interview or with the proceed with the consultation? And then you shall do that. So then you will be asking, ma'am, may I know what are your concerns for me today? And then the rest of the scenario. This is one part. The second type of scenario may be just going back a few steps. The patient may tell you that I already know about the CT scan. I already know about my scan results. I already know about the blood test results. I know that my kidney not working, and I have been sent to this clinic for the next steps. And then you will ask that, ma'am, may I know what are your concerns today? So those 3-4 minutes that you are spending discussing about that can be totally omitted. So if the scenario was like that, the patient already knows, and you are spending 3 minutes explaining the EGFR result, explaining the scan results, nobody will interrupt you. Okay, in the actual exam, they will let you tell about it, but you're wasting your time. If you have just asked, ma'am, how much do you know? Are you aware of what the results are? And the patient tells that yes, I'm aware of these results, and then you can just move on. Okay, I hope you got the difference between the two. So there can be like
Yes,
two,
sir.
yeah, like two pathways here. So you have to take in one pathway. So having done that, next is what are your concerns? You've already asked that question. Then the patient will tell you the concern. That is basically the issues. The issue in this scenario was mostly about RRT and transplant explanations. So we should be doing that. So the patient will tell you that I have read about the renal replacement therapy after the doctor told me. I got what it is, but I want to know more about in details, as I told you. And then you told quite nicely actually about the how it is. So any procedure. So renal replacement therapy is a procedure, right? Just a minute, okay. So any procedure, what we usually how we usually deal with a procedure is, so suppose you have to deal with a procedure. Procedure can be anything. Procedure can be a CSF tap. It can be under a spinal anesthesia, a general anesthesia, an intubation and mechanical ventilation. Any of these or n number of procedures, like renal replacement therapy, central line, central venous catheter insertion, artery insertions, anything. So any procedure, you have to go through a few steps. So the first step is consent. You have to explain even in one line that everything will be done after taking your permission. So this is just where we are explaining it to you, but everything will be done after taking your permission. Second is it will be painless as much as possible. In explaining, Dr. Amla, you told her there will be some pain, but AV fistula is absolutely painless procedure because you are giving a local anesthetics. So how to explain that? You can tell that the first time when you are pricking the local anesthetics, there will be a prick, but once we are done with that, we shall be injecting the drugs and we shall be giving adequate time for the whole area to be numb, right? And then we shall be doing the fistula. The fistula is the procedure through which we shall be doing the dialysis. You can just end it there. No need to go through the artery and the vein and the differential between the connections and those things. Nobody is interested in listening to that. Okay. So that is one part. The third part is sterility. It will be a totally sterile procedure. The fourth thing is safety. How till the safe? We do this procedure many times a day. Very experienced doctors will be there, the nursing staff will be there, other helpers will be there. Besides, we shall be doing it in a procedure room, which is a controlled environment, and the chances of any uncured incident is pretty less. But even if it happens, we shall be totally prepared to deal with it. And what may be those incidents? It may be pain. We shall be giving more local anesthetics. It may be bleeding. We have a blood bank, and from where we can give you the blood, or it can be some injury. We have surgical we have the surgical team, and they will intervene if necessary. So by that, just 2-3 lines about each of the complication of procedure, and you can end that thing there. And fifth is monitoring. Usually monitoring you after the procedure also. And the sixth is preparation for the procedure. Preparation means NPO status, any investigations needed before the procedure, anything needed to be done after the procedure, any x-rays, any scans needed to be done, something like that. So if you follow these six, I think there are 6-7 things. So if you follow these things, and if you just mention one line of each of them, immediately you will get all the marks that they can give regarding this, because renal replacement therapy explanation basically explanation of a procedure, right? So because Dr. Amla told that she's been doing it after 7 years, so that's why I was trying to guide her through it. But in the actual exam, they will not, right? They will not be helping you with that. Yeah. So if you follow these 6 points, then you will be covering most of the points, if not all. Okay. And then another issue with the patient had with RRT was she had read about the dialysis problems. So which were mostly these: pain, bleeding, hypotension, infections, hospital stay. Hospital stay not needed. You can come to the hospital and go away the same day. If some problems occur, then yes, maybe a couple of days of hospital stay can be needed, but that is rarely needed, if at all. Infection control, as I told, it will be completely sterile. We do it in a separate procedure room. experienced people, chance of infection is minimal. And if there is a chance of infection, then you shall be giving some antibiotics to take care of it if needed at all. Hypotension, yes, it can happen, because hypotension, yes, it can happen, but we shall be monitoring you. We shall be probably giving you some some blood pressure medications. If you're already on blood pressure medication, you should hold it. We may be giving you some IV fluids. We shall be monitoring you during the procedure and after the procedure to prevent this. Bleeding and pain, I have already told. So whenever you are asked about the problems, of course, like, everybody giving the exams are experienced people, so I don't think anybody will tell that there are no problems at all. So tell about the problems and then give 1 to 2 lines where you tell how you will be dealing with the problem, because the station is not about hearing the problem but about how you are explaining the problem and how you are dealing with it, that how you shall deal with it if the problem at all happens. Because if you are doing that properly, only then they will give you the first step, only then they will give you the consent, otherwise they will not agree to it, right? That's what happens in the day-to-day practice also. So that is how you are dealing with the RRT. So if you are following these steps, then it will be much easier to deal with it, because you're already spending about 5 minutes here, right? 5 minutes here. So here you have to deal with an RRT, you have to deal with a transplant, and of course the ending. So basically have 5 minutes each. 5 minutes here, 5 minutes here, 5 minutes here. And you can't miss any of them because there will be separate marks for all of them. So once you are dealing with, so in the 5 minutes you have to explain all these things, which is pretty difficult. So you have to be pretty fast. And the transplant, actually, you see, when I told that I want to know more about transplant, you did not ask me anything in particular I want to know about it, right? Because you cannot tell everything about transplant in the 5 minutes. Nobody expects you to do that. So every time the patient actively asks you something, not only in this scenario, but in any other scenario also, ask them another question. Are you concerned about anything in particular regarding this? If yes, of course they will tell you, yes, I'm worried about the infection rate after transplant or something like that. Or what will be the duration for which I shall need to take the medicines which suppresses my immunity. And that will be that. So ask them that and then proceed. So here if you ask me, I would have told that I have read about transplant rejections, that the transplant did not work. So what happens then? It's a direct question. 30 seconds for me to ask, 1 to 1.5 minutes for you to answer. You told me about the immunosuppressants, about the surgical process, about the suitability of the transplant, everything. I did not uh, want to know about that. I wanted you to solve my concern. You did not solve that because you don't ask me about my concern. So this question, what's your concern for me? This is quite possibly the most important question, and you need to ask this question at least 3 to 4 times when you are at the communication station. Otherwise, you will lose marks. You will not do the communication well. If you ask this question 3 to 4 times at proper intervals, your communication station will go very well. It is a very easy station because you can easily pass the session without knowing anything about the subject matter. Anything about without renal transplant, anything without knowing the transplant. Because of course, nobody interested in knowing about that. And the end, you always have to end the session well. So when you see that you have got like 5-6 minutes left, then you tell them that, ma'am, we have already discussed about this dialysis, we have discussed about the transplant. These are very big things, and probably we shall need another session to discuss more about this in details. If you need, we can arrange for our more senior persons or consultants to be placed at that time. How does that work for you? Of course, the if you are if you dealt with the resource session well, then the surrogate will tell you that sounds awesome. So then you can tell that, ma'am, can I ask you a few more questions? And then you can ask them that, ma'am, have you anybody accompanied you here today? So during these dialysis days, will somebody be coming with you? Whom are you living with? Smoking is very important here. Smoking, because that is a directly associated with the renal disease, as you know, and also with the transplant also, right? So ask about smoking here. And finally, ask them that you shall be fixing an appointment with whom? With a rheumatologist, because they have mentioned the rheumatologist person for a reason, to see whether you are active, because the rheumatologist will be involved, because it will be a multi sorry, yeah, so it will be a multi-care team. So the rheumatologist and nephrologist, they will be informed, they will be involved, dialysis technicians, the dialysis nursing people, they will be involved. So we shall be following up with a rheumatologist, and we shall also be giving you these the pamphlets and the websites. And there is something called the transplant help desk or RRT help desk. We can refer to you to them for more information. How does that sound? And nice to meet you, and thank you, and that will be the end. So keep at least 5-6 minutes for that, 4 or 5 minutes for the beginning, and keep the remaining 10-12 minutes for the issues and those things, right? So don't think that only by solving the issues and not by a good ending you'll be getting more marks. It will not like that. It's how you are structuring your meeting also. And here you had a lot of time, I mean, a lot of things to discuss also. So try to extract exactly which part of that information the patient wants to hear. Otherwise, it's meaningless. Dr. Amla, do you have anything to ask me or any other candidate also?
Hello, sir.
Hi, Dr.
Hello.
Aman, right?
So, am I audible? Yes, sir. So, actually, there's a thing you said about specialty registrar ST2. They are very junior. Actually, I'm not familiar with these terms. What are the position of different faculties in UK
Doctor, you don't
settings?
need to know, because you see the MRCP is, they're expected to complete MRCP by ST4. So they will not, they will not have an ST5 or an ST6 sitting there. Okay. So whatever the designation is, that person will be a junior person only. So yeah, so why I told
Okay.
that, because just a minute. One of the questions to Dr. Amla by me was, "What's next for me?" Dr. Amla told that I shall admit you and I shall prepare you for the dialysis, right? So that is an extra information. Nowhere it is written that the patient is needed for admission, right? So these things are very
Yes, sir.
serious. You cannot ask a patient to be admitted there and then unless it's mentioned that there is some absolute indication for admission. Because why has the patient come to you? To know more about the dialysis, to more about the renal transplant. The patient needs some time to
Renal
think
transplant.
about
Yes.
it. You can't ask the patient to be admitted in the same setting, especially if you are a junior person. And in MRCP PACES communications, you will be a junior person only, because you are not expected. I mean, it will not be a senior person doing that. So it's a junior role. So stick to what they have told in the cards. Okay, don't add information to that. Don't tell that it will be a thrice a week dialysis. What is written? Maybe it will be a once a week dialysis, maybe it will be a twice a week dialysis. No, I didn't thrice a week dialysis, right?
Mhm.
Right, yeah. So don't add information.
Yes, sir.
Yeah.
Sir, ST2 means already doing nephrology residency, no, not medicine. Like
No,
someone
no.
already completed MRCP and then got into nephrology
No, 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 no,
subspecialized.
doctor. No, 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 doctor. It does not mean that. It means specialty training. Specialty training is general medicine, and who have been posted in the nephrology clinic. Okay, that
Okay.
person is not a specialist.
Specializing.
Yeah,
I
yeah,
mean,
yeah, yeah, yeah,
okay. Yeah.
yeah. Anyway, even if any information is not being given in the scenario, unless it's obvious, like, so you are working like it's an emergency scenario AED, and the person has come with a poisoning or whatever, something which obviously needs to be admitted. There you can tell that we shall admit you, right?
Hmm.
But not here.
Yeah.
Yeah. And it's very important for you to know what to get an idea about how the scenario will be from this information. Okay. Okay, so now we shall be moving on to the next case. Next case will be a bit shorter one because this lots of things to discuss. So who will be taking up the next case? Just unmute yourself and we shall continue. Anyone can just. unmute and Dr. Abhijit, you have messaged something. Have you leave? Thanks. I did not get that, but Dr. Amla or somebody else, Dr. Latif is also there, so you can just take up, or anybody else can take up the scenario, and we shall
Sir,
begin the.
actually, I want to take the case, but my signal is not working properly. There will be disturbance for the candidate. So I'm not, that's why I'm not going for the case. There is a frequent disconnection in my.
Okay. So who will be doing the case?
So what is the case?
No, the case I shall tell you once the patient person is selected.
Okay.
Dr. Latif, you can do the case. I mean, your signal seems good enough. If there is any distraction, we shall just change.
Okay, okay, sir. Okay, sir. So
Yeah.
I'll continue.
Yeah.
Okay. Hello, Miss Ollerton. Myself, Dr. Aman. May I know your number and your age?
Yeah, doctor. Good afternoon. Nice to meet you. I am 18 years old.
Okay. Do you know what is the main concern I'm here to talk to right now?
Doctor, I am scheduled for discharge today. The consultant told me that somebody will be meeting up with me, and yeah, so I am waiting.
Okay, actually, I am here to talk to you regarding your disease and the discharge today. So, can you please tell me about the disease you have for the last for 13 years? You
Yeah.
so what is the problem you had for
Doctor, I am
for which you
diagnosed with
have been
asthma.
admitted?
Yeah, doctor, I am diagnosed with asthma.
Okay, so you are familiar with the process of the disease. What is asthma and what are the complications of it?
Yeah, I get this shortness of breath occasionally, and sometimes it's very severe. I have been admitted in the past for that, and then I get better and I get discharged.
Okay, okay. So do you, as it said that you have been admitted 9 days back in ICU, and you have been shifted to respiratory ward 5 days back. So how are you feeling right now at the time of your discharge?
Yeah, doctor. So, I have been admitted here for the last few days. I was initially very sick. I was in the intensive care unit, and then I have shifted to the ward, right? And today, and I got better gradually. And today, I'm shifted. I'm like scheduled to go home.
Okay. Do you have any concern regarding your disease right now?
My main concern is that why am I getting admitted repeatedly?
Okay. The thing is, basically, asthma is a chronic disease in which there is a recurrent episodes of breathlessness. So, are you on your inhalers or any form of nebulization
Yes,
previously?
doctor. I am on inhalers and a few other medicines that my pulmonologist has prescribed me previously.
Okay. And are you taking it on a regular basis or you taking it in intermittently?
I'm taking it as being prescribed regularly.
Okay. Okay. So basically, in asthma, if you generally don't take your inhalers as advised or taking in a proper dosage, there will be chances of exacerbation of the disease. So
Okay.
most probably it will leads to regular admissions and worsening of symptoms. Do you know? Do you have any thing you want to ask regarding it?
No, as I told, I want to know that despite taking my inhalers, why am I not getting, this is very poorly controlled, right? So I understand that even with taking the inhalers, as has been advised by my doctors, I still can get the attack, which has been explained to me. But surely that frequency of the attack should be less, right? It cannot be like this frequently. So why is it happening? Hello.
Yes,
Yeah.
yes. Actually, if you're taking the medication, then there. Hello, sir.
Yeah, yeah, I'm here.
Sir, actually, it's disconnected right now. Okay, okay. Hello.
Yeah, I
Actually,
can.
if the patient is not hello.
Yeah, I can listen to you.
Okay, sir. Okay. So basically, if you are not having your symptoms control on inhalers, there is an option of starting biologics or drug which can control the symptoms for you. So, do you ever heard about biologicals in your treatment follow-up?
No, doctor.
Okay. So your main concern is about the frequent admissions instead of being on regular inhalers, right?
Yeah,
Do you take it as advised and the time of the day it has been advised to you?
yeah, absolutely.
Okay. Okay. Do you have any forms of addictions or any form of social?
I smoke occasionally.
Okay. Do you ever had an episode of breathlessness while you were smoking?
No.
Okay.
Yeah.
And what about the hello?
Yeah. Hello, I can hear you. Just continue.
Actually, it just disconnected again and again. I don't know how to proceed with it.
Okay. So you see, I shall be taking a class only on it. Okay, because this is not how you approach this scenario. So just a minute. Yeah. So I shall be teaching you how to approach the case of bronchial asthma and this thing because it's very commonly asked in the exam. Okay, because you are asking about biologicals in the when it's not mentioned anywhere here. Anyway, so you see, these are the common pitfalls in a case of bronchial asthma, which you need to cover when the patient is not controlled. It's same with COPD also. So it will be the same thing. So, in a case of bronchial asthma, which is not being controlled, initially you'll be starting as you did with the initial introductions and those sort of things. I'm not going through that again. But then in the next steps, you have to ask the patient what is the concern which you did. That was also okay. And the main concern was that why is it not being controlled, right? The patient and the first question is, are you taking your inhalers regularly? And what about follow-ups? The patient taking inhalers regularly and the follow-up is good as prescribed by the pulmonologist. So the second question should be, what is the technique of the taking the inhalers? Has anybody taught you that? Have you gone to a bronchial asthma clinic where the inhaler technique is being taught? If no, then immediately you will know that that is the cause. So then you need to explain that, ma'am, I am sure you will be taking the medicines, but to take the medicines inhalers, there's a particular way to do it, right? There is a particular way of starting it, of taking it, and then exhaling it and inhaling it. So that will be taught in more details in the bronchial asthma clinic or in the inhaler sessions clinic, which is specially organized by that bronchial asthma clinic only. So uh, we shall refer you to that clinic. Also, there are websites and flyers and videos available which you can go through, and that is the end of that. And then you ask the other things. What are the other things that for which the patient may be having these recurrent bouts of bronchial asthma? So this is where the because in the previous scenario these things are not that important, right? But here these things are the most important. You have to ask about the daily life of the patient. What does the patient work? What is the working environment? Have the patient got these attacks while the patient was working or when the patient was at home? If the patient was at home, are there any pets with the patient? And did the attacks occur when the patient was, playing with the pets? What did the attacks occur when the patient was playing outside? Was there any the attacks more occurring when when there is change of seasons, or when any exposure to pollens, new flowers, new food, these sort of things? I hope you got it. Like pets, work, pets, pollens, cold, playing, running around, and lastly, smoking, alcohol, any drugs, these sort of things. At least one to two, the patient will tell that that is the reason that yes, I am having these attacks more when this is happening, or I have pets, and these attacks have increased since I brought the pets home, or I have changed the jobs, and the attacks have happened when there has been a change of jobs. So, if there is a change of jobs associated, always tell the patient that can you change your that since this seems to be like associated jobs, we shall be referring you to the employment help association, employment helper association, who will be helping with that. Or if it is associated pets, never ever tell that you can't have that pet, because they will take it as an offense to their personal life and to their freedom. Okay, don't do that. Tell them gently that maybe it's associated pets, so we shall get you tested for the allergens and then we shall come to conclusions. Okay. And seasonal asthma, so just to explain that you have to be more careful when the season changes. If there is any allergens, any pollens, then again tell them that avoid that. Right. Smoking, in this scenario, they will either this technique special will be involved or a smoking will be involved, and the any of these things. So there will be at least 2 to 3 triggers involved, which you have to cover. Smoking, for smoking cessation, you can just, if you tell them that ma'am you need to stop smoking, they will, because this, in this current scenario also, if they would have asked me to stop smoking, I would have told her I can't do that because I love smoking, because I'm already stressed about this asthma and these things. So I get stressed out a lot these days, and I smoke. And not only that, my smoking, the number of cigarettes have also increased. So now you have a job on your hand, right? You have to explain to them first. You have to ask them why the stress. If they tell you the asthma is the stress, then tell them that if they stop smoking, the asthma will decrease, and then the stress will decrease, and then they can automatically decrease the smoking as well, because it's a vicious cycle. If something else like work stress, immediately tell them that you will be supporting them there. If it is a family life stress, maybe, and more older person, a divorce is going on, the parents are sick, there is any problem at home, tell them that you will get a social help, you will be helping them there also, right? And tell them that you are sorry, do need a minute, we shall be helping you with this way. Don't only listen, always give them the explanation, always try to help them. And finally, of course, we have the smoking cessation clinics, we have the nicotine chewing gums, we have the nicotine patches, and we have got the medicines, anti-smoking medicines, right? And also tell them that not only bronchial asthma, you can get a COPD, you can get an ILD, that is a permanent lung damage, and of course you can get a lung cancer also. And not only you, your loved ones are also getting exposed to the smoke, so passive smoking also dangerous. So lots of things to cover in the smoking part. And in this scenario, usually that is the cornerstone, along with the techniques and the spacers. So this is how you need to do this. And always the follow-ups and the pamphlets and the websites, those things needs to be there also, right? And they have given you some weapons also. See, she has had 8 admissions last 1 year, 4 of which ICU, twice ventilated. So you can tell that if you don't stop the smoking, you can be admitted to ICU, you can be ventilated, and once you are ventilated, the outcome becomes very dubious. You do not know whether you will coming out of it. Just because you have come out of it 2 times does not mean you will come out of it third. right? It's very painful to you. You already know this. There is a chance of infections. There is a chance of other organs being affected. There is a chance of death. Tell them that. If they are not accepting anything, tell them that, right? You are not frightening the patient. You are telling them about fact. So use this information very well. This you did ICU 9 days ago, respiratory 5 days ago, now ready to be discharged home. Diagnosed with asthma at the age of 5. So this is basically pediatric asthma. Very difficult to control as it is, right? We all know that. So this is how you deal with an difficult to control bronchial asthma, difficult to control COPD patient, right? Yeah. So just before you join this class, those who are active participants especially, so they try to practice in the next week, because next Friday or sometimes next week on 10 days we shall be having another session. I like to teach. I don't mind going through the whole case alone also. But if you are prepared, at least one or two of you, then you can at least participate, and that will help you more. That's how I view this, because whoever is participating in the class, nobody is preparing at all. So it will be better if you just go through the there are free videos available on YouTube. There are other materials as well which you must be having. So just go through them. Then it will become more interesting and more rewarding also. Right? Any questions?
So next week we'll take communication or LCC.
I am selected only for communications, doctor. I am not supposed to take LCC, I think.
Okay.
Okay. Yeah. I don't think there are many questions. So just go through these scenarios which we have discussed last class 2 and this class 2, and next class we shall be discussing 2 more. So, and if you have any questions or concerns on how to approach, you can just ask me in the next class. And Sana, so we shall be ending the session today.
Sure, sir. We'll be ending our session. Probably next session will be on 27th or 26th. It will be abdominal. To all the aspirants, please try to attend the session. As you know, it is going to be an interactive session, and many doubts and further, if any queries are there, it will be solved. Thank you,
So it
everyone.
will be abdominal station, means how we'll be examining, what cases will be kept, those
Yes.
things will be discussed.
Yes.
Okay.
After abdominal, we'll be doing cardiology, respi, like that. It will go. But as you know, it is a month of December, so we are trying to arrange a class, as we have faculties who do have holidays, and the aspirants also won't be able to attend. So we'll be arranging it accordingly. Thank you, everyone.